Mental health is an ongoing public health issue within the military veteran population. The Veterans Project was created as a community agency which will provide mental health services for veterans in the Baltimore, Maryland area, promoting the reestablishment of veterans' independence post service. As an agency, we are committed to serving those who served our nation. Every day, veterans battle against poverty, addiction, and mental illness. Across the United States, veterans make up 11% of the total homeless population. The stigmas and limited resources available often prevent many veterans from seeking out help while actively serving, and this continues to be a barrier during their transition back to civilian life. The Veterans Project seeks to restore the feeling of mission within a team and call upon the warrior ethos as a reminder that no one fights alone. Our belief is that by providing mental health resources, we will give veterans a restored belief in themselves to empower the community towards action and hope with a new mission. Our mission is to provide whole health services to military veterans in order to guide them toward healing and to gain back their independence. By providing mental health counseling and resources for medical care, job placement, and housing placement, we aim to empower each veteran to encourage other veterans while on their own path towards healing. Our vision is to eliminate post-war mental illness and aid in combating homelessness and addiction amongst all veterans. We seek to provide a safe and stable environment for veterans to find their purpose and for them to help others do the same. We desire to see veterans living out their next mission, to thrive as a civilian. The Veterans Project is committed to providing dependable, client-centered approaches to veteran mental health. We consider the whole individual benefit and well-being, as well as strive to empower our clients to reach out and work with their extended military brethren for the betterment of all veterans in the community. This builds a strong community centered around patriotism, healthy life choices, and service to others. We accomplish this by partnering with clients, organizations, and agencies to curb homelessness of veterans in the local Baltimore area communities. Our core values are 1. To meet a need. We do this by working with veterans to obtain a better, more sustainable quality of life in a safe and secure environment. 2. To lead. We are committed to research and utilize the most effective practices available. 3. To care. We ensure that compassion and dependability are provided with the utmost professionalism. And 4. To respect. We are determined to safeguard the human dignity, autonomy, cultural diversity, rights, and the uniqueness of every veteran in ethical, honest, and forthright manner. The counseling services which the Veterans Project provides consists of outpatient psychiatry, therapy, consultation and assessment, counseling, and specialty treatments. Psychodynamic therapy is also utilized in group counseling sessions, and we offer family counseling as well.
Since 2001, deployment numbers reflect over 2.8 million Americans serving in hostile locations such as Afghanistan and Iraq. While typical adjustment to post-deployment life is successful, there are instances where the trauma and challenges of the battlefield carry over into everyday life. At the Veterans Project, we provide a broad spectrum of outpatient care focused on education for continued healing while establishing long-term recovery plans. Alternative levels of care may not support the realities of daily life post-deployment, so our outpatient services focuses on supporting a veteran's new life with a minimal amount of weekly treatment sessions. While reestablishing their daily routine, veterans can still benefit from our many services. Our group therapy reinforces the skills and mindset of military subculture by emphasizing teamwork and community. Upon completion of service, veterans tend to feel isolated and lost due to the separation of a military collective identity. The Veterans Project seeks to restore this collective identity and aid in the formation of new identities and directions separate from military service, specifically using the psychodynamics group therapy model. The decision to enlist in military causes an emotional ripple effect among the soldier's family. The Veterans Project offers the opportunity for military families to have a safe space to express their emotions, as well as to be provided with resources to make every stage of transition a little easier. Our services are also available to the families whose loved ones will never return home from duty. The Veterans Project strives to care for the whole individual and the support system around them. The Veterans Project is a for-profit organization and has completed the process of becoming a limited liability company. To complete this process, the Veterans Project has ensured their name is not in use, nominated a Maryland resident to be our resident agent, paid the fee, and have obtained an employer identification number from the IRS. Individual counselors with the Veterans Project are required to carry their own personal American Counseling Association liability insurance, offered through their ACA membership. Counselors are also required to maintain $100,000 to $300,000 liability insurance coverage on their personal auto insurance policy to qualify for reimbursement for mileage if their personal vehicle is used. The Veterans Project carries a general liability policy, malpractice insurance policy, a business owner's policy, and a workers' compensation insurance policy to fulfill legal requirements as an employer. The Veterans Project will often be dealing with private patient information that must be kept confidential, which is why it is imperative that our organization maintains HIPAA and high-tech standards of privacy. We have created policies and procedures which are taught through mandatory trainings for all employees. Refresher trainings throughout the year will keep the Veterans Project following these standards. A checklist for HIPAA compliance will be adapted to include areas that fall under this Act, and policies are in place to train counselors and administrative personnel. The Veterans Project counselors carry a Maryland state license as either a licensed clinical professional counselor, a licensed clinical marriage and family therapist, or as a licensed clinical alcohol and drug counselor. The Veterans Project requires counseling staff to be members of the Maryland Counseling Association for continued education courses, public policy issues, new laws, and grant availability in addition to their ACA membership required for insurance. Since the Veterans Project collaborates with the ACA Veterans Interest Network, counselors are also required to become involved with this network.
It is important to note the dedication to the highest standard reflected in the Veterans Project completion of several requirements for credentialing with the Cigna Behavioral Health Network. Each individual clinician under these standards are required to have a license to practice within the state of Maryland, professional liability insurance with minimum limits of $1 million, $3 million for physicians and psychiatric nurses with prescriptive authority, and all other licensed providers must insure coverage up to $1 million. Some key notes about clinic requirements include at least 10 practitioners and multidisciplinary staff, of which 3 or more practitioners must hold master's level certification, 1 practitioner must hold license to prescribe medication, and 1 practitioner must hold a doctoral level certification with license in conducting psychological testing and evaluation. In addition, the clinic participates in enrollment in the Council for Affordable Quality Healthcare Universal Credentialing Database, which simplifies the insurance process for both patient and provider. The Veterans Project filings for reimbursement through Cigna relies on an electronic data interchange vendor, Availity, for submission of claim, which reduces administrative burdens on staff and reduces the amount of administrative errors leading to resubmissions and lost revenue and time. Notably, the Veterans Project also maintains insurance credentialing for Medicaid in the state of Maryland that requires acceptance through the Maryland Department of Health's designated administrative service organization, Beacon Health Options. In order to become approved Beacon Health Options Provider Network, the following requirements had to be fulfilled, including maintenance of a 24-hour call service, crisis intervention services available 24 hours and 7 days a week, and a live after-hours telephone answering service or machine that directs an individual in crisis to an on-call clinician, crisis team, or hospital emergency room. The Veterans Project staff collaborates administratively to ensure continued availability of crisis services to meet client needs and secure Medicaid reimbursement. Standard A2E of the American Counseling Association Code of Ethics states that counselors need to discuss the required limitations to confidentiality, including what information will be shared and with whom. The client may choose to refuse service, in which case a counselor should share the consequences of refusing service. Some clients of the Veterans Project may be mandated by the court due to committing a crime or living on the streets. Our policy is in place to effectively and ethically treat these clients, ensure the client knows their rights, and professionally guide counselors through ethical dilemmas. At the Veterans Project, every client, mandated or not, has the right to refuse counseling services. The client must understand both the confidentiality agreement and the refusal of service agreement and sign whichever form they are agreeing to before the start of the counseling services. The counselor will read through and ensure the client understands the confidentiality agreement tailored to mandated clients and the refusal of service agreement, which states consequences for refusing service. The tailored confidentiality agreement includes specifics on what types of information must be shared and who this information is shared to. The client signs the form they are agreeing to, and if the client agrees to counseling services, the counselor will refer back to this agreement before each session to remind the client of the limitations to confidentiality as a mandated client. The Veterans Project does not consist of inpatient treatment, so a client can potentially come from another health facility. Following the American Counseling Association Code of Ethics, the Veterans Project is committed to building strong professional relationships with other health professionals in the Baltimore area to serve our veterans to the best of our abilities. These formed relationships include referrals and record sharing. The Veterans Project staff will fully participate in interdisciplinary work with other health professionals in the Baltimore area. We commit to referring our clients to outside sources when their needs would be better met by another health professional. All record sharing is done once permission is obtained by the client. When a client is referred to the Veterans Project, we ask the client to read and sign a release of information form to allow us to ask the referring party for information regarding the client. When a client's needs are more advanced than we can provide, we refer the client to another health professional and obtain the client's permission to share their records. The Veterans Project offers couples and family counseling services to the families that support our veterans. According to the American Counseling Association Code of Ethics, the counselor must clearly define who the client is and make sure all parties understand the expectations and limitations to confidentiality. At the Veterans Project, every person in the couple or family is considered the client. All parties must sign a confidentiality agreement tailored towards couples and family counseling, stating the limitations to confidentiality when working with multiple parties. All minors must have a legal guardian signature. Before a counselor begins their first session with the couple or family, they must read through and clearly explain the confidentiality agreement specific towards counseling a couple or family. Clear expectations of confidentiality are written out to give clear guidelines to all clients. The confidentiality agreement also includes limitations when a client may be a threat to themselves or others, or if any form of child abuse exists. The counselor obtains signatures by all parties, with legal guardians signing for any participating minors, and before each session, the counselor will refer back to the agreement. The Veterans Project uses Availity, a third-party electronic data interchange clearinghouse, for filing insurance claims through Cigna's Behavioral Health Network. Use of Availity services provides a direct relationship with Cigna's coordination of benefits, along with increased claims accuracy, processing efficiency, fewer resubmissions, and streamlined payment mechanisms. Availity's proprietary provider portal offers an easy-to-use online interface for translation of non-EDI clinical information and notes into EDI insurance claims. Availity software covers all of Cigna's published clean claims submission requirements to include standard International Classification of Diseases, ICD-10 codes, 10th revision, provider, and therapeutic procedural notes in accordance with the claim form, CMS 1500. Availity reduces the administrative burden since all claim submissions through Cigna must occur within 90 days of treatment.
The Veterans Project recognizes the importance of technology and makes sure to integrate these tools to better assist our clients. We've implemented electronic medical records to really create a more organized and more streamlined method of storing patient data. So instead of paper-based records that can easily be misplaced, the Veterans Project uses EMR software that's accessible to counselors and administrative staff. The Veterans Project also utilizes an online scheduling platform so that clients can log into a portal and schedule their own appointments based on counselors' availability. Counselors also use the portal to confirm or deny the appointments that are requested by clients, and also to set homework assignments for their clients to follow in between appointments. To reduce the risk of confidentiality, the Veterans Project makes sure to implement firewalls and encryption whenever handling patient information, and also when dealing with online communications between staff and clients. The Veterans Project also makes sure to host periodic trainings for staff to maintain privacy practices and ensure proper use of our online resources. This really greatly influences adherence to treatment plans and also allows clients to have easy access to the care that they need. The Veterans Project is committed to providing professional counseling services which consider the financial status of each client in accordance with the Code of Ethics. Typical fees at the Veterans Project are as follows. Individual counseling sessions are $100 per hour, family counseling sessions are $150 per hour, and group counseling sessions are $75 per hour. The Veterans Project also recognizes that some clients will not be able to afford the standard counseling fees. Because of this, we're committed to providing services to disadvantaged populations without any discrimination based on socioeconomic status. Counselors who work at the Veterans Project will be required to set aside weekly time slots for clients that are requiring pro bono services, and counselors can also employ a flexible sliding scale based on the income for clients that are lacking insurance coverage or for clients who are unable to pay the full rate for services. At the Veterans Project, we seek to ensure that there is no veteran or family member that is turned away based on inability to pay. Counselors of the Veterans Project participate in one of 5 community outreach programs in the Baltimore area monthly. Counselors can choose the Community Resource and Referral Center, which is an organization that provides at-risk and homeless veterans access to community-based mental health care services. Counselors can also choose to focus their interest and their efforts at the Homefront Work Group, which is an organization that's dedicated to discussing, formulating, and implementing strategies and policies for proper care management of veterans. Counselors can also participate in the Soldiers Project or the Wounded Warriors Project, both of which offer free psychological treatment to military service members in the Baltimore area. The Veterans Project counselors who desire to lend their labor skills can also do this with the organization called the Sixth Branch, which is a local community service initiative motivated to tackling community service projects with the help of local veterans. These monthly outreach initiatives will motivate our counselors to advocate for their clients in the community. It's been shown that several veterans in crisis find themselves separated from the collective identity formed during service without the help of teammates, leaders, and family. The Veterans Project follows the combat equivalent of a quick reaction force, which is familiar to military combat veterans in crisis for rapid response, whether through a phone call or emergency response by a clinician. The clinician works with the local emergency services in the community to respond to crisis events that are involving veterans by offering immediate services and protection of the military veteran through the transfer of care to an inpatient treatment facility. Clients at the Veterans Project encompass a wide range of ages. Since crisis and trauma can affect veterans at any point in life, counselors are trained and certified in handling various situations. All counselors are trained in trauma therapy as well as de-escalating life-threatening situations. In addition, staff members that are certified in crisis intervention rotate being on call and can link veterans to organizations in the community such as the Veterans Crisis Line and the affiliated Sante Group, the Baltimore County Crisis Response System. A select number of counselors will also be certified in geriatric counseling, since crisis and trauma can impact an elderly veteran. Geriatric counselors can help the elderly with monitoring their mental health and including helping to cope with depression and other life changes. The Veterans Project has an internal emergency procedures manual that's sent to all employees before they begin employment at the Veterans Project. This manual is updated when necessary. The manual includes preparedness and response plans for all relevant emergencies and threats. The manual also provides procedures for evacuation and communication with clients when we must close the office. Man-made disaster management includes lockdown procedures with different color codes that indicate the severity of the emergency. In the manual, the needs of the staff are addressed and our policies on how to protect, evacuate, and recover personal health information in the event of a disaster are outlined. Evacuation routes and assembly areas for staff are also designated, and individuals' responsibilities are explained. Finally, included in the manual are the different floor plans of the building, a staff roster, and contact information for relevant emergency services so that everyone has access to important contact information.
The Veterans Project collaborates with a variety of organizations such as the U.S. Department of Veterans Affairs, Aid Our Veterans Organization, and the American Counseling Association Veterans Interest Network. The U.S. Department of Veterans Affairs serves as a federal government agency representing the healthcare needs of U.S. military veterans and their families. Although the VA administration offers comprehensive health care to veterans and their families, limited resources and rigid governmental structure prevent care for reaching over 3/4 of the U.S. veteran community post-service. Wood 2014. The Veterans Project collaborates with the VA to fill these critical gaps in mental health care through VA-funded grants and advocacy seminars. Services offered in collaboration with the VA include helping veterans apply for benefits and navigate the VA system, provide alternatives for outpatient treatment services outside of VA facilities, assist with transition of care, and connecting veterans with social services and local homelessness shelters. The Aid Our Veterans organization. One of the big issues with veterans is the inability to find a job when they return from their services. The Aid Our Veterans organization is a nonprofit organization that focuses specifically on this need. Some of their more notable services include locating housing, coordinating counseling and visitation to veterans in hospital and rehabilitation centers, job training, and job placement assistance. The Veterans Project coordinates with Aid Our Veterans organization by providing counseling services to these veterans and will work with this organization to meet the mental health needs of all veterans they serve. The Veterans Project will work closely with the Aid Our Veterans organization for continued education on the needs and trauma these veterans we work with are going through. The ACA Veterans Interest Network. The ACA Veterans Interest Network is comprised of counselors, veterans, military family members, active duty members, and non-military personnel who serve not only as a sounding board for what works in counseling therapies, but also as an advocate for non-medicated therapeutic approaches for the advancement of healthy lifestyles and longevity in military clients. The Veterans Interest Network aids counselors in navigating the Department of Veterans Affairs and providing members with up-to-date current issues that affect the military population. The Veterans Project counselors collaborate with the ACA Interest Network by using their collective knowledge to advise and educate staff on military-specific matters. All Veterans Project counselors are members of the American Counseling Association, which provides access to the Veterans Interest Network platform, various networking groups, and community tools specific for service members. Advocating for mental health care for all veterans is a key component of the Veterans Project. Recently, legislation was passed in the House of Representatives giving mental health care access to veterans who had been previously prohibited due to being other than honorably discharged from duty. Lending our voices to and raising concerns over key issues relating to veterans obtaining mental health care is important to the success of our organization. The Veterans Project partner with the National Alliance of Mental Illness Maryland, who advocates for insurance marketplace reform, prioritization of mental health care in the state budget, and removing barriers preventing mental health care services. With this partnership in place, the Veterans Project is a leader in advocacy for mental health care efforts in Baltimore, Maryland. The remaining slides are a list of references used in this presentation. We hope you enjoyed listening to our presentation and have a great day.